Hi guys, this is a case of a 45-year-old gentleman with a left lower quadrant pain. And in the beginning, I'm going to take 15-20 seconds just to scroll through the images to see if something catches my eyes. In the lung basis, there's this atelectasis. I didn't see a pleural effusion, pneumothorax, pulmonary consolidation. Let me go down to the abdomen now. Liver, grossly looks okay. Gallbladder looks okay. Pancreas looks okay. Spleen looks okay. Kidney, I didn't see a big renal stone. I didn't see hydronephrosis. Let me scroll down. Here I actually catch, I bet this is the appendix, even though I'm not seeing all of it, but I didn't see any inflammatory changes in this area. I keep going down more. Here down in the pelvis, I see a lot of fatty stranding inflammation going on. And right away, I can tell that the sigmoid colon, the wall is really thick. There's a lot of inflammatory fatty stranding around. This makes me think it's diverticulitis. Do I see any diverticuli? Like a little bit. Like here, there may be a diverticula. Here, there may be a diverticula. There's one, there's one. So sometimes even in someone that does not have a lot of diverticulae, you can have diverticulitis. So in this case, my diagnosis would be that this is a case of acute diverticulitis. Now, the things that are catching my eyes is that there are these air around that could be outside of the bowel loop. Let me take into a long window. Let's see right here. Right here, I think that's outside the bowel loop because there is a bowel loop here, but it's kind of going this way. So this is air outside of the colon, and especially right here, there is no bowel loop right here. So there's free air. Let me go up more to see if I do see any other free air. I don't. And the other thing I want to see is that if there's any loculated collection or abscess. So there is a small amount of ascites here, but the wall is not thick for me to tell that it's an organized collection or an abscess. At this point, I would probably just call ascites. Let me come up. And the other thing that catches my eye is that right here, there's peritoneal thickening. Now, normally you would not see a peritoneum. Let me go up. Now here, you have the anterior abdominal wall and the peritoneal lining may be somewhere around here, but you can't tell where the peritoneum is. But if I go down here, you can tell that this is where the peritoneum starts, and outside of here is the anterior abdominal wall, and inside of the peritoneum is the abdominal cavity. So there is some reactive peritonitis, um, perforated, or call this a perforated